back to our videos. I'm Dr. Keep from By Design Optometry. We are a local optometry clinic in Edmonton and also a vision therapy clinic in Edmonton. So we do provide vision therapy in Edmonton as well as just comprehensive eye exams. Today we are going to talk a little bit about computer vision syndrome. With us is one of our staff members, Jenny, so we'll welcome her as well. There's studies done through the American Optometry Association that actually indicate that 50 to 90% of computer users suffer from vision syndromes associated with dry eye. And recent studies done through the Alberta Optometry Association are actually indicating that it's even a little bit higher than that. So this is certainly something that significantly impacts patients when they're spending long hours on the computer every day. This is something that I see again every day in the clinic. So we're spending long hours on the computer. Oftentimes patients have jobs where they're on the computer for 8 to 10 hours a day, and then they come home after work and they are playing video games or spending time on their phone or reading on tablets. So I would say the average adult patient is spending easily over 10 hours a day on the computer, and children are also spending really long hours as well. So there's a lot more digital use in schools, and they often have hobbies that involve a lot of cell phone use and video games and stuff like that as well. So dry eye associated with computer vision syndrome as well as other symptoms are something that we see every single day.
What is computer vision syndrome?
So computer vision syndrome is something that affects the eyes from sustained computer use. So when we look up close on a computer screen, the muscles in our eyes, they have to focus more than what they do for far away. So we develop a lot of eye strain type symptoms, and sometimes you can actually even get spasms of your accommodative system from doing sustained near work. We also tend to not blink as often as we should on digital devices. So it's really, almost a compulsion to just stare at the screen on your digital devices. So because we're not blinking as often or looking away as often, dry eye, as I mentioned, is really significant for patients who spend a lot of time on the computer. So when you couple this with the effects from blue-violet light that's emitted from computer devices, all of this together creates symptoms that we describe as computer vision syndrome.
Okay.
Yeah.
What are some symptoms of computer vision syndrome?
There can be multiple different symptoms. So computer vision syndrome can cause eye strain, fatigue, or headaches associated with extended computer use. Patients can also sometimes notice blurry vision or double vision. And one thing that often surprises my patient is the blurry vision doesn't necessarily have to be on the computer. So we do sometimes have patients where, they spend long hours on the computer and then they notice when they leave to drive home from work that their vision far away is actually blurry. And this is from the eye muscles. They've been straining so long all day that at the end of the day, when you have to look far away, they don't just immediately relax. So you have those spasms of the accommodative system as well. So blurry vision at near or at distance can be a symptom. And then any symptoms associated with dry eye. So you can get the red, burning, stinging eyes, excessive tearing, fluctuating vision, that sort of thing as well. These things are very commonly associated with computer vision syndrome.
Okay.
Yeah.
How common is computer vision syndrome?
Computer vision syndrome is very common. So as I mentioned, this is something that we talk about in the clinic almost every single day. As I mentioned, the Alberta Optometry Association, they conduct surveys, and they were actually getting stats that up to 70% of patients actually are bothered on a daily basis by symptoms of computer vision syndrome. Yeah.
Oh, wow. Who is most susceptible to computer vision syndrome?
Really anyone that spends long hours on computers or any digital device up close is susceptible to computer vision syndrome. So most patients that I see with computer vision syndrome, they have office desk jobs where they are on a workstation for multiple hours a day. Or patients who have hobbies, if they play a lot of video games, for instance, or a lot of computer games, or, reading, or even Facebook and stuff like that on the computer, you can develop computer vision syndrome. And we actually are starting to see symptoms of computer vision syndrome in some older children as well, just because there is such a significant demand for near work nowadays, kids are often getting really long hours of exposure to near work and more frequently on digital devices than what they were before. So it's actually not uncommon for kids to actually have symptoms as well.
How do you test for computer vision syndrome?
There isn't really a specific test for computer vision necessarily. We always go through and do a history on the patient for sure. So we ask about their exposure to computers and other digital devices, and how many hours they spend a day doing these types of near work activities. And then we conduct our eye exam, where we go through and measure specific exam findings. So we'll go through and look for signs of dry eye, or look for things like accommodative spasms, or those sorts of things. So there's not necessarily a specific diagnostic test, but it's quite easy to tell if the patient's symptoms are from computer vision syndrome.
What are some ways to treat or prevent computer vision syndrome?
The best way to treat computer vision syndrome is prevention. So taking breaks from the computer is really important. We always like to talk to patients about what's called the 20-20-20 rule. So of course, as optometrists, we had to come up with this rule. So basically, the 20-20-20 rule is for every 20 minutes of computer work to take just a 20-second break to look at something that's 20 feet away. This can be really helpful. Even just that quick break from focusing the muscles up close can make significant impacts on computer vision syndrome. For some patients, I actually recommend that they download a timer of some sort on their workstation to remind them to look away, because again, it's easy to forget how quickly 20 minutes does actually go by. We often will do dry eye treatment for patients as well if they're experiencing dry eye symptoms from computer vision syndrome. So that can be something as simple as just using artificial teardrops, or sometimes we have to do more complex dry eye treatments as well, depending on how severe the dryness is and how long it's been there. We can also prescribe special lenses or contact lenses. So they do make anti-fatigue lenses and anti-fatigue contact lenses where there's a little bit of a reading component in the bottom of the lens, and the purpose of the reading component is to just relax the muscles of the eyes just ever so slightly, just so that they are more comfortable. For patients who have near prescription, so if you're over the age of 40 to 45 and you actually wear progressive lenses, we do lots of workstation lenses for patients. So it's a modified type of progressive lens where it gives you a much larger zone designed for the computer, so that you don't spend as much time trying to kind of search for that clear zone. So they're much easier to use, and there's a lot less distortion, and because you spend more time in the proper portion of your glasses, it does significantly reduce symptoms of eye strain from the computer. And then we often talk to patients about special coatings on their glasses. So you can get blue-violet filters and stuff like that that actually reflect that blue-violet light that's emitted from digital devices. This can help with eye strain symptoms, or patients, if they spend a lot of time on their cell phones right before they go to bed. It can help with sleep issues and stuff like that associated with blue-violet light. So that's something that can be really beneficial to patients.
Okay.
Yeah.
What is the difference between computer glasses and your regular reading glasses?
Yeah, this is a great question as well. So as I mentioned before, there are special lenses that are designed specifically for the computer. So for progressive lens wearers, I really like the computer specific lenses because it gives you much wider zones. So they're more forgiving to use. And then again, the coatings that we can add to computer glasses, they help to cut back on that blue violet light, as we talked about as well. For patients who aren't progressive lens wearers, you can get what's called an anti-fatigue lens, as we talked about. It's kind of the same principle as doing a progressive lens. I sometimes call them like baby progressive lenses. There's just a really mild reading prescription that just helps to relax the muscles of the eyes, so that instead of your eyes having to focus all day throughout the day while you're on the computer, your glasses do a little bit of the focusing for you.
And what can parents do to protect their children from computer vision syndrome?
Again, the biggest thing with kids I like is always prevention. So kids are spending really long hours doing near work. In fact, the incidence of nearsightedness and myopia is actually increasing in children, and I think part of it has to do with the exposure to excessive near work. So there are studies that find that children who spend more than an hour and a half a day doing near activities actually have a greater incidence of having nearsightedness at a young age, and the type of nearsightedness that progresses quickly to the point where they could develop severe myopia or nearsightedness. So the best thing you can do for your kids is actually try to eliminate as much exposure to digital devices as possible. Certainly in school nowadays they do have to, do homework often on computers and stuff like that. So it's not always realistic to completely eliminate it, but try to take frequent breaks, the same as you would as an adult. So for every 20 to 30 minutes, try to encourage them to do an activity that involves looking far away, or better yet, doing some sort of outdoor activity.
Okay. And how can people get in touch with your clinic to book an appointment?
Sure. We always assess for computer vision syndrome during our comprehensive eye exam. So you can either give our office a call at 780-444-6407, or you can also jump over to our website at www.visionbydesignoptometry.com and book an appointment yourself online. If these are something that you feel like you have any questions or concerns about, we'd be happy to do an assessment to see if there's maybe some signs of computer vision syndrome.
Great, thanks.
Yeah, you're welcome. Thanks again for joining us. So again, I'm Dr. Sarah Keep from Vision by Design Optometrist. We do provide comprehensive eye exams as well as vision therapy in Edmonton. This is Jenny. Thanks again for joining us, Jenny.
No problem.
Hopefully you found that to be informative. And now that you're done the video, go ahead and do the 20-20-20 and take a break. Let's all look 20 feet away and relax those eyes. If you enjoyed our video, after your break, come back and you can subscribe to our YouTube channel.